Rickets is a disease of growing bones. Here there is a defect in mineralization of growth plate, the growth plate, which is also known as epiphysis. Main problem is there is a mineralization of the epiphysis, that is growth plate. Cartilage at the epiphysis. Here in every bone there will be cartilage and also calcium and phosphorus crystals. If the cartilage is not mineralized with calcium and phosphorus crystals, then there will be weakness of bones, improper shape of bones, and poor growth. Okay. What are the clinical features? Craniotabes, which is also known as soft skull, cracked pot appearance due to improper closure of sutures, improper and delayed closure of fontanelles, improper and delayed closure of anterior and posterior fontanelle. Wide and these are the features of skull. Craniotabes, soft skull, cracked pot appearance. Like if you tap on the cracked pot, if you hear the sound like same sound if you tap on the skull. Okay, improper and delayed closure of fontanelle, wide and wrist. Epiphysis of the long bones is also widened. Delayed dentition will be there. Forehead brossing, that is frontal bossing, will be there. Genu varum, which is also known as bow legs. Genu valgum, knock knees. Here in bow legs, the distance between the knees is increased, whereas genu valgum, the two knees will come towards to the middle. Okay, it is also known as knock knees. In chest there is rachitic rosary. I have shown here rachitic rosary. Here this is the cartilage part of the rib and this is the bony part. In between the cartilage part and bony part there will be like bead like enlargement in all the wrist, leading to some like a rosary, like rachitic rosary. Okay, if in radiograph also it appeared like the rachitic rosary. Harrison groove, because the rib cage is very fragile. The diaphragm will when there is contraction of the diaphragm during inspiration and expiration, there will be inward indrawing of the diaphragm, leading to a depression like subcostal retraction, also known as Harrison groove. Due to indrawing of the diaphragm, there will be subcostal retraction of the rib cage, leading it's also called as Harrison groove. There will be failure to thrive, protruding abdomen, weak muscles, weak muscle weakness, and fractures. There will also be scoliosis, kyphosis, lordosis, spine deformities, because there will be involvement of all bones, because there will be defect in all the bones. There will be involvement of rib cage, spine, long bones, wrist bones, of legs, everything, skull. Okay, and if there is severe hypocalcemia, there will be hypocalcemic symptoms. Radiology, there will be fraying, which is also known as loss of sharp border. See, normally the bone end is like very sharp and have a convex appearance, whereas the sharp border is lost. This is called fraying. And cupping means normally there will be convex shape, but due to rickets it will become concave like a cup. So these features can be seen in the radiology. And there will be thickened wrists at the epiphysis. There will be thickening and rachitic rosary. I have already told this will be appeared. There will be enlargement between the cartilaginous and bony parts, bead-like appearance in the chest radiograph. Next we will come to etiology and lab. There are different etiologies. It can be divided into vitamin D deficiency, which is nutritional, malabsorption, improper sun exposure, vitamin D dependent rickets type 1, vitamin D dependent rickets type 2, calcium deficiency, either nutritional or malabsorption, phosphorus deficiency, either nutritional or malabsorption, hypoparathyroidism, chronic renal failure, which is also called as renal osteodystrophy, hypophosphatemic rickets, hypophosphatasia, Fanconi syndrome, tumor-induced rickets, liver disease. So in all these conditions, there will be features. There will be rickets. Okay. Now we will see the lab in each of these condition. In vitamin D deficiency rickets, the 25 hydroxy vitamin D will be deficient, but 125 hydroxy vitamin D, since it is in less quantities, it will be decreased only if there is large amounts of deficiency of 25 OH vitamin D. If little amount of deficiency, there the 125 OHD will be normal, because it is in minute quantity. If there is only large deficiency of 25 OHD only, there will be deficiency of 125 OHD, or else it will be normal. So to measure the vitamin D value in the nutritional or malabsorption vitamin deficiency, 25 OHD is ideal, because if there is little deficiency in nutritional deficiency of vitamin D, there will be no change in 125, it will be normal, only there will be change in 25 OH vitamin D. So it is ideal in nutritional improper absorption and improper sun exposure to measure. And calcium will also be normal or less, because calcium will depend on 125 vitamin D, it might be normal or less. Phosphorus, it will be less, and parathormone will be more, because vitamin D 25 OHD is less. Both the phosphorus will always be less when vitamin D deficiency is there, either 25D or 125 OHD, the phosphorus will be less. If these are less, there will be reflex increase in the parathormone. If any one of this is less, then parathormone will increase. If any one of these two is less, phosphorus will decrease. Okay, you remember that. Alkaline phosphatase in all types of rickets except in hypophosphatasia, in all types of rickets alkaline phosphatase is increased. Urine calcium is less, urine phosphorus is more. Okay, because vitamin D is deficient, there will be loss of phosphorus in the urine. Okay, VDDR type 1, vitamin D deficient rickets type 1. Here there is the problem in 125 hydroxylase enzyme in the kidney. So it's unable to convert 25 hydroxy vitamin D to 125 hydroxy vitamin D due to deficiency of 1 alpha hydroxylase enzyme in the kidney. Because of this 125 OHD will be normal, but 125 OHD will be deficient. Because of this, calcium will be deficient, phosphorus will be deficient, and parathormone will be elevated, and everything is same like previous one. VDDR type 2, here the vitamin D, both the vitamins are normal in their chemistry, but the receptors in the body on various organs which 125 OHD will act are not proper, they are impaired. Because of this, it cannot act on the receptors, and its action is not proper. Because of this, there will be reflex increase in 125 OHD, because there is problem in the receptors, not in these chemicals. Okay, and everything is same like above 2, because there is improper action, calcium will be deficient, phosphorus will be deficient, parathormone will be increased, ALP increased, urine calcium decreased, phosphorus is increased. And calcium deficiency nutritional, this 125 OHD will be increased, 25 OHD will be normal, calcium will be decreased, phosphorus will be decreased, and parathormone will be increased, phosphorus will be decreased or normal, parathormone will be increased, and ALP will be increased, urine calcium and urine phosphorus will be increased. Okay, in calcium deficiency, vitamin D will be increased because calcium is deficient, and parathormone will also be increased. In all conditions, when calcium is deficient, parathormone will increase because it helps in replenishing the calcium values. So in all the things, when parathormone is increased, calcium is decreased, Calcium, when calcium is decreased, parathormone will increase. Okay. Phosphorus deficiency, 25 OHD normal, calcium 125 OHD elevated, because when phosphorus is deficient, vitamin D increases. Calcium and parathormone are antagonists, whereas phosphorus and vitamin D are antagonists. If phosphorus is deficient, vitamin D increases. If calcium is deficient, parathormone will increase. Okay, you remember this. And parathormone is decreased. Phosphorus is decreased, parathormone will decrease. Okay, you should remember this. In phosphorus deficiency, parathormone will decrease to increase the activity of vitamin D, and ALP is increased. Urine calcium is increased, but urine phosphorus is decreased. Okay, here you should remember it's different from all the above conditions. Serum phosphorus is less, because of this urine phosphorus is decreased. Hypoparathyroidism, here both vitamins are deficient, because they depend on parathyroid hormone, and calcium is decreased, phosphorus is increased, parathyroid is decreased, ALP is increased. Chronic renal failure, it's important, renal osteodystrophy. Here main problem is there will be a increased amount of phosphorus, because there will be in urine the phosphorus excretion is impaired, so there will be increased amount of phosphorus. And vitamin D3 is absent, vitamin D3, because of this, because it's produced in kidney, 125 OH. If in kidney failure, the 125 OH is less, whereas phosphorus is elevated. Calcium is decreased, parathormone is increased. Because calcium is decreased, parathormone is increased, ALP is increased, urine calcium decreased or normal. Okay. Hypophosphatemic rickets, here also the phosphorus is lost in the urine. Here the problem is in the phosphorus channel in the kidney, congenital problem. Because of this, so much phosphorus is lost, there will be improper mineralization of bone, leading to rickets. Here the phosphorus in the serum is low. And hypophosphatasia, here the problem is alkaline phosphatase is less. It leads to improper mineralization of the, it leads to demineralization of the bone, because alkaline phosphatase helps in the proper mineralization of the bone. It leads to demineralization of the bone and increased calcium in the blood, leading to hypercalcemia. Fanconi syndrome, here also there will be loss of phosphate in the kidney, from the kidney, leading to hypophosphatemia, leading to improper mineralization. And in tumor induced rickets also, there will be loss of phosphorus in the urine, leading to hypophosphatemia. And liver disease, mainly because of in liver 25 OHD is produced. Both 25 OHD and 125 OHD are not or deficient, leading to rickets. Both phosphorus, calcium, vitamin D will be deficient. Okay, PTH and ALP will be increased. This is all the lab. As phosphorus decreases, I already told, as phosphorus decreases in all conditions, as phosphorus, vitamin D levels increase. Vitamin D levels will increase as phosphorus decreases. There is a relatively except in two conditions, like tumor induced rickets and hypophosphatemic rickets, there will be relative decrease, that is no proper increase in vitamin D, though phosphorus level decrease. In these two conditions, there will be no appropriate increase in vitamin D. In all other conditions, as phosphorus decreases, vitamin D levels will increase, but in these two conditions there will be relatively decrease. As calcium decreases, PTH always increases, parathyroid hormone always increases. I already told, calcium decreases, parathyroid hormone always increases in all the conditions. Okay, nutritional rickets, I already told, because 125 OHD is in minute quantities, 25 OHD, if it reduces also, in the 125 OHD will not reduce. If it grossly reduces 125 OHD, then only the 125 OH3 levels will decrease. So ideal value to measure in nutritional rickets. 25 OHD is the ideal to measure in nutritional rickets. In VDDR type 1, I already told 1 alpha hydroxylase is deficient in kidney. In VDR type 2, receptors of vitamin D is deficient in all the parts of the organs of the body. In renal osteodystrophy, that is in chronic renal failure, phosphorus serum level elevated because it's not excreted in the urine, the phosphorus serum levels are elevated. Whereas in Fanconi syndrome, more phosphorus is excreted from the urine, leading to reduced phosphorus in the blood. In hypophosphatemic rickets, tumor-induced rickets, phosphate loss from the body. This leads to 125. Usually, if the phosphate is lost in the body, 125. I already told 125 OHD should increase. But here in these two conditions, it is not increased but relatively decreased. I already explained this point. What are the complications of rickets? There may be hypocalcemic seizures, growth failure, and bone malformations. Treatment in vitamin D deficiency, initial STOS therapy. That is 6 lakh international units in intramuscular or oral for 1 day in 2 to 3 divided doses. Okay, or you can give vitamin D high dose for every day, 5000 international units per day for 4 to 6 weeks. This is the initial dose, followed by maintenance dose. So you can give the STOS therapy, like only 1 day therapy in 2 to 3 divided doses. You can admit in the hospital and you can for 1 day and you can give. This is very reliable because the doses are given by you. Whereas it is given for 4 to 6 weeks everyday high dose, they might take or not in the home. So it's better to give STOS therapy, followed by maintenance dose, 400 international units in less than 1 year, in 600 international units in more than 1 year per day, every day, for around 2 to 3 months. In calcium deficiency, acute symptomatic should be treated with 10% calcium gluconate, 100 mg per kg, that is 1 ml per kg bolus in IV bolus in children, or 200 mg per kg, that is 2 ml per kg IV bolus in neonates. In children it is 100 mg per kg, that is 1 ml per kg. In neonates 2 ml per kg IV bolus slowly over 10 to 20 minutes, followed by 80 mg per kg per day in neonates, or 100 to 200 mg per kg per day for 2 days in children. So for neonates, 80 mg per kg per day and 100 to 200 mg per kg per day in infusion, continuous infusion should be given for 2 days, followed by maintenance. In neonates it is 40 mg per kg per day, or 100 mg or 1000 mg 1 gram in children. So here maintenance in neonates is 40 mg per kg per day neonate, or 1000 mg in children. You can give orally also. This is maintenance. First you should give bolus for 2 days. You should give 80 mg per kg in neonates, 100 to 200 mg per kg in children, and after that you should go for maintenance. In phosphorus deficiency, 1 to 3 grams of elemental phosphorus can be given every day until phosphorus deficiency resolves. In symptomatic patients, acute treatment is 0.1 to 1.5 millimole per kg per day over continuous infusion. So this is about the rickets. If you have any doubt, please you can please press in the comment button, and if you want any videos, any topics to be explained, you can ask me. I will be always ready to explain you in detail. And if you like the video, please press like the button and subscribe to my channel. Thank you very much.